In this video, we'll talk about the QT interval and the QT correction. Okay, simply, when we say the QT interval, it's actually the start from the Q wave till the end of the T wave. And this time represents the time taken for ventricular depolarization and ventricular repolarization. That being said, we remember that the QRS complex represents ventricular depolarization, and the T wave represents the ventricular repolarization. And if we want to interpret this definition on the mechanics of the heart, this represents the period of ventricular systole to period of ventricular relaxation, which is the isovolumetric relaxation. So it's actually the period of ventricular systole from ventricular isovolumetric contraction till the isovolumetric relaxation. Now, the most important information here is to know that the QT interval is actually inversely proportional to the heart rate, meaning that the QT interval shortens at faster heart rates and it will be lengthens at slower heart rates. So if the heart rate is not 60, we have to do some calculations to correct it. Okay. Now, when we are measuring the heart rate, when we are measuring the QT interval, this is important. Why we have to measure the QT interval? Because if the QT interval is prolonged, especially if it is more than 500 milliseconds, this will increase the risk of torsade de pointes. Okay, so we have to keep an eye on the QT interval all the time. Now, the QT interval usually is measured in lead 2 or V5, V6. And whenever we are measuring the QT interval, we should use the longest measurement. So we don't depend on one lead. We go with both the lead 2 or V5, V6, and we take the longest measurement. And even in the same lead, when we are measuring it, we measure it on successive beats, and we are taking the maximum interval, okay? To make sure that we are not increasing the risk for a patient to develop torsade de pointes undetected. So this is very important. Now, whenever we are calculating the QT interval, you should keep in mind where to stop calculating, when to stop the measurement. Now, so that being said, now let's look here. If we have a U wave and the U wave is small and separated from the T wave, it's not included in the measurement. So how to determine this? This is very easy. We go with the T wave and we take the longest slope of the T wave. And we draw a line on the longest slope of the T wave. And once it dissects the isoelectric line, this is the point where we stop the calculation. So we start from the Q wave till the end of the T wave at this point. Okay. Now, look here. If the U wave is fused with the T wave, shall we take this point here or here? And again, as a rule of thumb, we go with the longest slope of the T wave. This is the longest slope of the T wave, and we draw a line on the longest slope of the T wave, and it dissects here. So it dissects here, so we stop here. So the QT interval will be at the beginning of the Q till the end of the T wave here, not here. Okay. And the same thing here. Look here, the U wave, actually, this is not a U wave. This is only a pi-fed T wave. It has two peaks. So to determine where to stop, you go with the longest slope of the T wave. This is not the longest slope of the T wave. This is the longest slope of the T wave. So we draw a line with the longest slope of the T wave, and it dissects the isoelectric line here. So this is the stop point. So we calculate the QT interval from here till here, okay? So this is very important, guys, to understand whenever we are calculating the QT interval length. Now, again, we should correct the QT interval for the heart rate. So whenever we are correcting the QT interval, this would estimate the QT interval at a standard heart rate of 60. So this is the only circumstance that you don't need correction. If the heart rate is actually 60, you don't need correction. It's already corrected, because the idea of the correction, again, we talked about this. The QT interval is inversely proportional to heart rate. So if the heart rate is very slow, the QT interval will be prolonged. This is not accurate. This is falsely prolonged, right? Because this is the effect of the heart rate. So you have to correct it as if the patient has heart rate of 60. So the 60 beat per minute, this is our standard, okay? So if the EKG shows a heart rate of 60, actually you don't need to correct it. But this is not the case all the time, right? Patient can have any heart rate, 75, 79, 90, 110, 150, 40, whatever, right? All right, so we have 4 formulas to estimate the QT interval, the corrected QTc interval, and it is not clear which formula is most useful. So we have different formulas. We have the Paget formula, we have Fredericia formula, Framingham formula, and Hodges formula. Now, just some information about these formulas. The first 2 formulas, the Paget and Fredericia formula, they actually logarithmic corrections. So they use algorithms. And they are very hard to calculate by your hands, right? You need a calculator. Whereas Hodges and Framingham, both of them are linear corrections. Okay, they are easier to use. Now, Paget formula is the most commonly used one. And whenever you have a heart rate between 60 and 100, which is the normal heart rate, Paget formula is very accurate. However, if the heart rate is outside this range, either below 60 or above 100, the Paget formula is overestimating the QTc interval. So in this case, we use either Fredericia or Framingham. I love Framingham more. Now, fortunately, guys, there are multiple phone apps and online websites that can calculate the QTc interval for you. The most useful one is actually mdcalc.com. We always use that application. You need only 2 information to calculate the QTc interval. Number 1 is the heart rate, because you are always correcting to the heart rate. And number 2 is how many small squares as the length of the QT interval. So you just calculate how many small squares is the QT interval, and you enter these data into the app, and it will gives you your corrected QT interval. Now, this is very important here. QTc interval, QTc, the corrected QT, is prolonged if after correction it is more than 440 milliseconds in men or more than 460 milliseconds in women. Okay, now if the corrected QT interval is above 500 in both genders, this will increase risk of torsades poids. Okay, so the number is 500, the most important number, because I really don't care if a man has a QTc interval of 460 or 480, okay? Especially like if he's normal, no compliance, I don't care. But if his QTc interval is more than 500, this is worrisome, okay? So be careful about this. Now, as a rule of thumb, normal QT is less than half. Look here, normal QT, not the QTc. The QT that when you are looking at EKG, the QT when you are looking at it, it is normal if it is less than half of the RR interval. Why? Okay, so most of the medical students and doctors just memorize this, but you have to understand why half of the RR interval, if the QT interval is less than half of the RR interval, this is normal. Look here. Now, again, we talked about this before. We said like the standard heart rate for the QT to measure the QT is 60, right? When the heart rate is 60. Now, if we remember from the rate calculation lecture, we said to calculate the heart rate, it's 300 divided by how many large squares you have, right? Large squares you have. But okay. Now, if the heart rate is 60, so how many large squares are there between the 2 RRs to say this is the heart rate is 60? Is actually 5, because 300 divided by 5 equals 60. So if I have a patient who is normal and has heart rate of 60, right? We don't need corrections here because his heart rate is 60. There are 5 large squares between the 2 R waves. Okay, this is important. So from here to here, let's see. I have 1 large square here, 2 large squares, 3 large squares, 4 large squares, and here 1, 2, 3, almost 4 small squares, and 1.5 small square here. So I have total of 5 small squares between these 2 R waves. Okay. Now, we said that torsades du points risk increases after the 500 milliseconds. Okay. Again, the distance here is 5 large squares. Okay, large squares. Okay. And torsades du points will increase after if the QT interval is more than 500 milliseconds. The 500, how many large squares is this? The 500. It's actually 2.5 because each large square is actually 200 milliseconds. So 200 milliseconds, 200 milliseconds, and 100 milliseconds. This is large square, half of a large square. So it is 2.5. Okay, now, if we go from here to 2.5 large squares, it's almost here. This is the half of the distance because the distance is 5 large squares. And to have a prolonged QT interval, the QT interval should be more than 2.5 large squares, right? Which is here. So at any point or any EKG, if the QT interval, when you calculate it, it's longer than half of the RR interval, this is prolonged by definition. Okay, and this is why we say half, because of these calculations. Okay, now, what can cause a prolongation of the QTc interval? All the hypothings, like hypokalemia, hypocalcemia, hypothermia, hypomagnesemia, all of these will make the heart contract slower. So the heart will, the QTc interval will be prolonged. Also, any ischemia, myocardial ischemia can cause this as well. Cardiac arrest, post-cardiac arrest will have also a prolonged QT interval. Some medications and antiarrhythmic medications can cause a prolonged QT interval. Dopaminergic inhibitors like metoclopramide, ondansetron, all these drugs can prolong QT interval. The raised intracranial pressure, if there is increased intracranial pressure, there is activation of vagal nerve. This will cause prolongation of QTc interval, and congenital syndromes can cause prolonged QTc interval. All right. And so, what can cause short QTc interval? Look here, the short QTc interval is actually not very important, but there are some syndromes that can cause it. Okay, the definition of short QTc interval is less than 350 milliseconds, and this can be seen in hypercalcemia. The heart is contracting very fast because of the hypercalcemia. So the QTc interval will be shortened, and digoxin. If the patient is in digoxin, we suspect that the QTc interval is decreased, is shortened. Moreover, there are some congenital short QTc interval syndromes in which the patient has increased risk for ventricular and atrial arrhythmias and sudden cardiac death as well. All right. Okay, let's take an example how to calculate the QTc interval. Okay, again, you use an app. We talked about MedCalc, MDCalc. This is very amazing app. You just need the heart rate, and you need how many small squares between in the QT interval that you are measuring. So let's take this example. Let's say this is a lead 2. Okay, this is lead 2. So what is the heart rate? So we go through here. I have one QRS, R wave, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. Okay, or is it 13? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Sorry, it's 12 R waves multiplied by 6. This gives me 72. So I will open the MDCalc and put 72. And after that, I need the small squares. So let's take any QRS complex. I love this QRS complex. You can take any one. So we start to run with the Q wave here till the end of the R wave here, almost here. Okay, and you measure and you calculate how many small squares is there. I think there are like 12, something like that, 12 small squares. There are 10. This is a large square. This is 5. And there are 5 here as well. There is 11 here and the 12 here. So I'm going with 12. So when I put 12 and the heart rate is 72, it's almost 526. And I will use Paget's formula because the heart rate is in the normal range. Okay, so it's a prolonged, right? It's a prolonged. This patient almost likely having hypokalemia. We have features of hypokalemia. We will talk about this in a different video. Okay, so this is how you calculate the QT interval. This is very important to know the patient risk for torsades du points. And that's it. Thank you.